I am Dr. Zareen Kidwai, and on behalf of AMWPA, it is my privilege to welcome you all back to the AMWPA Healthcare Lecture Series. Today, we are going to talk about flu vaccine in the time of COVID-19. I am going to begin with a surah, and this is, of course, Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alameen. Ar-Rahmanir-Rahim. Maliki Yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdina siratal mustaqim. Siratal lazina an'amta alayhim ghayril maghdubi alayhim waladdallin. Ameen. In the name of Allah, most gracious, most merciful. Praise be to God, the cherisher and sustainer of the worlds, most gracious, most merciful, master of the day of judgment. Thee do we worship, and thine aid we seek. Show us the straight way, the way of those on whom thou hast bestowed thy grace, those whose portion is not wrath, and who go not astray. So before I introduce you to our speakers, I would like to give you a brief information about my organization. This is American Muslim Women Physicians Association, AMWPA for short. And we have started these virtual lecture series on healthcare recently. I hope they will benefit you. This organization is a nonprofit organization, and we are basically based in North Texas. Our motto is preventive healthcare is our passion. And to that end, we use health fairs and health education series as our tools. We promote healthy lifestyle through education and offering promotionals such as free flu vaccines, handing out reusable and disposable masks. We have installed several AED equipments in the area masajid. To date, our organization has handed out more than 8,000 masks, and we have given out almost 2,500 flu vaccines. Just to put in a plug for our organization, we have upcoming flu vaccine drives coming up, and they are going to be in your masjid soon, hopefully in the month of October, no later than November. Do look out for your masjid flyer and see if you find the date and time of our flu drive. The AMWPA provides a unique platform for networking for Muslim healthcare professionals. The organization also mentors and provides scholarships and awards to needy students. Without much ado, let me introduce you to our speaker today. She is Dr. Sanober Kable. She is a very able and accomplished intensivist and pulmonologist. She practices mainly in North Texas area and various different hospitals. She will give you the details herself. Along with Dr. Kable, we also have Dr. Shazia Khan. She is an internist and hospitalist. She practices in Plano. And then, of course, myself, I am Dr. Zareen Kidwai, and I work for Parkland Hospital and Healthcare System. My specialty is internal care as a primary care physician. Dr. Kable, I will hand over to you.
Thank you. Hi, everyone. I'm Dr. Kable, as I've been introduced. I'm a pulmonologist, and I'm going to talk about flu in the era of COVID-19. It's important to get it every year, but it's very important to get it this year. So I'm going to start my slideshow at this point. Okay, so as you all know and been told that we are presenting this program and courtesy of American Muslim Women Physician Women Association, AMWPA. The flu vaccine is your best shot at stopping the flu. Why must we get a flu shot in COVID-19 pandemic? And we'll go over in detail in this presentation. Number one, I'll start out with this slide, which, this is a common question that we get. Do I have coronavirus? Do I have flu? Do I have cold? Or do I have allergies? So this slide kind of goes over quickly on what symptoms you may get mostly with coronavirus versus flu versus cold versus allergies. So typically the symptom onset with the coronavirus is gradual, and it appears between 2 and 14 days after exposure. Peaks usually between 5 and 7 days after exposure. Typically we'll get fever, coughing, mostly dry cough, but sometimes could be productive cough where there's sputum production. Tiredness. Now, shortness of breath, if you look among all 4 of these categories, mostly shortness of breath is present with coronavirus, and it's not as common with flu, cold, or allergies. Other symptoms, sore throat and headaches, muscle joint aches, chills, nausea, vomiting, nasal congestion, and diarrhea can also happen. But some of these are also present during flu season, symptoms. Also cold, you don't get as much fever. It's very rare to have fever with cold, but you do get coughing, which is also common with allergies as well. So this is just a quick overview. Now, let's talk about transmission of these viruses. Most of the viral illnesses will transmit through the respiratory system or through our coughing, talking. When we cough, talk, or sneeze, we have droplets that go down onto the surfaces, which is basically our spit or sputum or secretions, in other words. Some of those will go into the air and become, we call that atomization, which is basically small particles of our secretions, and they'll go into the air and they become aerosols. They can go all the way up to 6 feet, and that's where the social distancing comes from, is if we keep a 6 feet distance from each other, we can reduce the transmission of COVID-19 as well as other viral illnesses as well. When we talk about droplets, like we talked about in this slide, about what goes on the surfaces when we are talking and coughing and sneezing, there are 2 comparisons I gave here, one for the flu and one for the COVID-19. COVID-19 can stay on the body for up to 3 hours. Flu virus can stay on the body for up to 5 minutes. The reason the shorter duration on the body is because we do have antimicrobials in our body. Our body does fight infections. The skin has protective barrier, and that's where it's gonna, the flu virus or COVID-19 won't want to stay alive on the surface for too long, although that's where the hand washing comes in, that if you wash your hands frequently with soap and water, you can get rid of these viruses that are already on your body from touching surfaces. It can stay, now there are porous surfaces, that'll be cardboard, paper, and fabric. Flu can stay on the fabric, cardboard, or paper for up to 8 to 12 hours. On the other hand, COVID-19 can stay up to 24 hours. Also, flu virus on hard surfaces, for example, door handles, subway poles, plastic, stainless steel, glass, countertops, phone, and even the play equipment for the kids can stay up to 48 to 72 hours. And COVID-19 certainly can stay for up to 72 hours on hard, shiny surfaces. Copper has antimicrobial properties, so most of the viruses won't stay alive for more than 4 hours on copper surfaces. What kills these viruses? So it's, when we talk about chlorine, hydrogen peroxide, soap, or iodine-based antiseptics, and alcohol, we're just talking about cleaning the surfaces with them. It should never be drank or, or used in any other form. It should only be, and you shouldn't be using them on your body as well. because there is some toxic effects from these substances that can actually cause more harm. So this is only for cleaning surfaces, so that you make sure that people are not getting it from the surfaces. This is a very important saying, that an ounce of prevention is worth a pound of cure. And that's basically what our message is today, that if we can prevent the flu virus from spreading by taking a shot, we have to do that, especially when the healthcare system is overburdened right now with COVID-19. First question we get is, why should we get a flu vaccine? Number one, the flu can be lethal. In other terms, the flu also is called influenza. So basically we call influenza, in common terms, influenza is known as flu. It's basically the same thing. It is contagious. So if you have visitors coming to our family, or if you're going out or anything, we could have carriers that have no symptoms and they're just carrying the virus, and they can actually be super spreaders sometimes. And that's where the masks come in. Flu can cause up to 36,000 deaths per year, and about 200,000 people a year gets hospitalized due to influenza or flu every year. And 90% of these deaths are in people 65 and older. So even though majority of these people are going to be older, about 1 out of 10 people, 1 out of 10 patients are going to be younger than 65. Now, talking about seasonal flu versus pandemic flu, seasonal flu is flu A and B, which are usually highly contagious and cause most of the illness annually. They typically happen in fall and winter. Most of the time it'll spread through droplets, coughing, sneezing, and talking. The yearly vaccine that we get is basically the seasonal flu. The reason we get it every year, because there's some variations every year that are gonna happen in the strains of flu that we will not be immune to, and that are predicted for that year. So every year, the vaccine is typically different than the year before. And everyone should get a vaccine, even though our main focus is on people that are high risk. If everyone gets a vaccine, it protects people that have not gotten the vaccine, or people that don't believe in the vaccine, and also it also protects us from spreading it too far and gives us some amount of herd immunity. Now the pandemic flu, as we all know, 1918 was the Spanish flu that we all hear about. 1957, we had another pandemic flu. 1968, we had the next one. 2009 was another year that we had a really bad pandemic flu. And we are due for another one. The question is when, and that's where the concern is, that we want to make sure this year that we make sure everybody gets flu. So while the healthcare systems are overburdened with COVID-19, we're not dealing with another pandemic or another significant illness on top of what we're dealing with already. If there is a pandemic flu, typically there would be 2 vaccines. One would be seasonal flu, one would be the pandemic flu vaccine, which there's some reserve at CDC, but at that point, if we have limitation of the number of vaccines in that year, the priority will be to the people that are at the highest risk. The same question we get over and over again, who should get the flu vaccine? Very important to emphasize that everyone should get the vaccine. However, having said that, if you are older than age 65, if you have a family member or yourself, you're pregnant, if you have children between 6 months to 18 years of age, or if you have household contacts and you're a caregiver of a child under 6 months, you must get it as soon as possible, because you're at the highest risk of dying from flu and hospitalization from flu. But again, everyone should be getting the vaccine. This slide is a little bit blurry, but it kind of gives you an idea. There are 2 types of vaccine. One is, the flu shot, the typical shot that we get, which is made with inactivated killed flu virus. It is given by a needle, and it is approved for use in healthy people older than 6 months and people with chronic health condition, basically everybody older than 6 months. Then we have nasal sprays. So we prefer everybody, because of the effectiveness, the preference is the flu shot. But if you have, let's say, egg allergy, or for whatever reason you can't get the shot, the nasal spray is the other option. It is made with the weakened live flu virus, is given with a mist spray in your nose, and it's also approved for healthy people between the ages of 2 and 49 years of age, except for pregnant women, since it's a live virus. I wanted to touch base on some of the flu myths versus flu facts. So the myth is, people think the vaccines are not proven to prevent the flu. The real fact is that if you got the flu vaccine, you're 60% less likely to become infected with the influenza virus. Another myth we hear is that the flu vaccine can give me the flu. Now that's not true, because we already read in that previous slide that the flu shot is made with inactivated or killed flu virus. So that cannot give you infection. One more myth I hear is I should wait to get vaccinated, so I'm covered until the end of the season. The fact is, once you get the flu vaccine, it takes about 2 weeks for your body to develop antibodies. So you should get it as soon as possible, because you want those antibodies developed, so if you do get exposed, you are actually protected. The next one is the flu nasal spray is just as effective as the flu. The fact is, it's effective, but it's not as effective as flu shot. So that's why we prefer flu shots. Now, the one more myth we see is that flu shot will protect me from every type of flu virus, and that's not true either, because the flu shot is designed yearly to protect against the highest risk or highly active circulating strains of influenza. So even though it protects you from more common strains, it doesn't protect you against every strain. And it certainly doesn't protect you next year. So that's why you have to do it every year. Now, the timing and duration of the influenza season does vary, and outbreaks can start as early as September. That's the reason we're talking about it in September. However, typical season is in October. It does peak in January or later, and the late season outbreaks can also happen in April and even in May. This year, it's very important to get it as soon as possible, because we all know that we still have a lot of patients with COVID-19, and we still are dealing with struggles with these patients that are hospitalized. So the systems are overburdened at this point. Now, most of the seasonal epidemics are going to happen with influenza A and B. Influenza type C virus can also cause illness. However, that's going to be a mild respiratory illness. When we get the yearly flu shot, it has influenza A and B strains. It does not protect us against influenza C virus. So you may still have some viral illness, but it's usually a milder illness from the type C virus. Why we get the flu vaccine every year, I touched based on it earlier. There are small changes in influenza viruses that will occur continuously, and new strains may not be recognized by the body's existing influenza antibodies. And a person that's infected with a specific influenza virus strain develops antibodies against that specific strain. So let's say if you did get the flu and you got the flu A, you may still not have antibodies against flu B. So you may still get influenza type B. And that's why you need to make sure you get the vaccine so you're protected against both type A and type B. Annual influenza vaccination or immunization is recommended to protect against infection from these changing influenza viruses. Why should you get flu vaccine in 2020? Number one reason is to reduce hospitalization, because hospital systems are overburdened with COVID-19 pandemic. your physicians are tired, the hospital systems are full, and number two, if you go to the ER, they're not going to be able to recognize unless we do the testing to if you're dealing with flu A or B, or are you dealing with COVID-19, and you know, so there's a lot of healthcare burden that's associated with going to the ER and utilizing the healthcare system. Number two, if you get the flu shot, you can reduce the flu severity. And another important thing is when we get sick, we cannot work. And when we can't work, we are losing work days. So that's also a burden on your family and economy as well at the same time. So we want to reduce the loss of work days. And then last but not the least, you want to protect people around you, your family members, your loved ones, your neighbors. So it's these are the, I think, 4 more important reasons why we need to get the flu shot or a flu vaccination. Now today's panel is consists of Dr. Shazia Khan, Dr. Faryal Ghaffar, and Dr. Zareen Kidwai. We're gonna end the discussion here on the slideshow. We'll take any questions that you guys may have on the slides or in general about the flu vaccination.
I have a question. Is it safe to say that the reason why herd immunity has not been very successful in the US is that our rates of flu vaccination have been so low? So my understanding is that you need at least 50 to 60% vaccination rate
Correct.
to get herd immunity. And I think we're less than 50%, right? At best,
Yeah.
every year?
Absolutely, yes.
Can you comment on the high dose flu vaccine that I hear about the patients 65 and above to get?
So yeah, so patients 65 and above should be getting the high dose vaccine just because they're higher risk, and it's going to give them a little more immunity than the patients that are getting regular flu shot. Also will reduce the hospitalization.
Dr. Sanober, is that given in 2 doses, the high dose one?
Correct.
Okay. I think we have some questions in our chat box.
Let's see.
That is.
Perhaps Dr. Faryal can address the
Yes.
question about washing fruits and vegetables.
Yeah, it's recommended not to wash fruits and vegetables with these hydrogen peroxide. You should just clean it with water. It's not recommended because it could be toxic to your body. So people who put these hydrogen peroxide and other sanitizers on their skin or on the food products and fruits and vegetables, that has not been recommended. You should just clean the surfaces, wash the fruits and vegetables with water, but it should be just limited to the surfaces.
Also, this virus is not transmitted through the gastrointestinal tract. So if you eat anything and it has the virus on it, there's very little chance that you will get the infection.
There's another question. Do you need to ask for high dose or they give it to you for your age? So I think they should be giving it to you for your age. However, if you have a primary care physician and if they are giving the flu vaccine, you probably need to go there first as opposed to going to other places. But if you don't have the primary care physician, and if you're going to, let's say, CVS clinics, you should specifically ask for it. However, I would think that they would give it to you according to your age.
So there is a question about the age limit for kids to get flu vaccine. If I can answer that, as I'm a pediatric infectious disease specialist.
Yes.
So there's a limitations. You cannot give any flu vaccine to an infant who is less than 6 months old. There is no vaccine that is licensed for this age group. That's why it's very important that the parents and the people who are going to take care of that kid needs to be vaccinated. For inactivated vaccine, which is the flu shot, the age limit is, the minimum is 6 months, but for the flu mist, the live vaccine, it's 2 years. So the live vaccine, which is the nasal spray, cannot be given to a kid, to a child who's less than 2 years of age. So it's 6 months and 2 years.
And again, I believe the first dose of influenza vaccine, the first ever for a child, is also given in 2 doses. Am I correct,
Yes.
Dr. Faria?
Yes. So the recommendation is that if you are less than 9 years of age and you are getting the flu vaccine for the first time and you haven't received 2 doses previously, you should get 2 doses, and they are supposed to be given 4 weeks apart. So if for example, if somebody comes, he's 7 years old and he never got a flu vaccine before, or he only got 1 flu vaccine previously, then he should be getting 2 doses. As far as the live vaccine, the nasal spray goes, the recommendation is 1 or 2 doses. So you have you can either give 1 dose if you are less than 9 years of age and you got flu mist previously, you didn't get flu mist, which is the nasal spray, or you got only 1 dose. You have an option. You can give 1 or 2 doses in the current year. So for flu mist, it's like you have a choice. You can give 1 or 2. I will prefer giving 2, but for the flu vaccine, it has been recommended that you should get 2 doses.
There is one question about Joshanda. Is Joshanda good for flu?
So,
I am not qualified to answer that. I don't know if anybody else wants to address that.
I think would be more like a myth than a fact.
Yeah, it's more like a symptomatic therapy. You can take Tylenol, you can, put some Vicks on your chest. So that's more like a symptomatic therapy that you can do. But of course, it's not going to take care of the virus. It's not an antiviral or anything. So it will run its own course.
Yes, definitely hot liquid and the effect of the hot steam that comes out of it. But I don't want us to disregard Unani treatment or any other forms of treatments. It's just that we don't know about it. If you feel it is helpful, go ahead and use it. There is no harm in using it. But definitely we can pretty much tell you that it does not kill the virus.
There is a question about people who have high risk conditions like diabetes or they are immunocompromised. Do they get high dose flu vaccine? As far as I know, high dose vaccine is for those who are older, like over 65. Now remember, if you are immunocompromised host, you should never get the live vaccine. So the flu mist is the live vaccine. So that's why there are quite few contraindications for the flu mist. So if you are immunocompromised, then you should be taking the inactivated flu vaccine, which is the flu shot.
How much does it cost to get a flu vaccine?
I order the flu vaccine, so usually it's around $20. It depends. Every year it changes some, so there's not much of the margin. So it's like 25 to 28, that's what it ranges. So even when outside places are giving it, there's not much margin for the flu vaccine. So it's not that they're giving it's too expensive out, other places it's the same, almost like maybe they're making $1 or so.
Yeah.
For patients, it shouldn't cost them anything. Because, if they have insurance, it should be covered. It's more considered a preventive measure. So it should be free with insurance. However, if you are self-pay, cost could be from $30 to $50, I believe.
Yeah, most of the places, as far as I know, is like 30. It just depends on where you are going. If you end up into like care now or stuff to get it, if you don't have a primary care, then they may charge you extra for the administration.
Somebody had written in that, does the flu vaccine cause autism? And first of all, this is something that we as physicians have been working really hard in debunking this complete myth of vaccines causing autism in children. Vaccines are actually responsible why we are all sitting here now that we are. Vaccines have been responsible for eradicating a lot of these diseases. And this was actually there was I believe a scientist, a researcher, a physician many years ago. He had found some sort of faulty association between certain vaccines and possibly autism, but he himself later came out and admitted that it was wrong. So there is absolutely no evidence that the flu vaccine or any vaccine causes autism.
Correct.
So this is something that every physician is working really hard to continue to debunk, that there is absolutely no evidence of any causing of any autism that is caused by vaccines of any kind, including the flu vaccine.
There's another question. I think we addressed that in the slideshow, but it says some folks claim that they get more sick when they get or take the vaccine. Anyone of you want to?
Yeah, so, so when you get the flu vaccine, the inactivated flu vaccine, you're not going to get sick with it. It's like killed virus. And even with the flu mist, which is a live virus, it's a weaker virus. So when you get symptoms, it's just like when you get any other vaccine, like if you get measles vaccine or you get typhoid vaccine, you may have some side effects, like you may get a little bit fever, you may get chills, you may get body aches. So those are the side effect of the vaccine, but that vaccine is not giving you the flu. But remember, if you get flu, then you'll have worse symptoms from it and you'll be sick for a few days and you may even get complications. So then people say that I don't get the flu vaccine because I get sick with it. I always tell them that if you're going to get flu, then you'll be very sick with it. So you rather have some side effects. Not everybody gets the side effect, but if you have a side effect, that's okay.
Correct. And then by the time you're getting the vaccine, and it'll take 2 weeks for them to develop the antibodies.
Yes.
So they can actually get, if they got exposed to someone that had flu, they are still at risk for that 2 weeks. So it's not usually from the vaccine that you're getting sick. It's probably from exposure that you didn't know.
Yeah. There is a question from, I think it says Surya. It says, last year I had flu and doctor didn't recommend to get the flu vaccine. And she's asking, is it when it will be late? So the flu starts usually September, October, and it can last till March and April. The recommendation is that you should start getting the flu vaccine as soon as it gets available. So it's like in September or so, October, but it's never too late. So I have patients that come to me in Feb and they said, is it too late? And I say, no, because you'll have flu cases till April. So usually they recommend that you should get it before before December and January, because that's when it peaks, but it's never too late. So even if a patient comes to me in Feb, I will go ahead and give the vaccine if they missed it.
And even if you have had flu and it was confirmed by doing the flu test, it is still useful to get a flu vaccination, because as we just learned in the lecture that there are various strains of the flu. So you can still get another attack of flu. It is important to get the flu vaccine every year. Dr. Shazia Khan, do you want to take the next question about vaccine and dementia?
Yes, absolutely. Again, just as the question arose about the vaccines, causing autism, which is completely faulty. Same thing. There is no clinical evidence between, the flu vaccine or any vaccine precipitating dementia. Dementia, there are multiple types of dementia, of which getting any kind of vaccine absolutely has nothing to do with it. Mm-hmm. And then I believe there was another question as well, that why do all viruses come from China? I think, first of all, that is an unfair generalization. And I think that unfortunately that comes from a place of prejudice, which unfortunately has precipitated, it may have been precipitated in the media. There's, you can't say that all viruses are coming from China or some other XYZ country. I mean, viruses can really originate from any part of the world, even within our own country here. So I think that, we should always listen to our physicians, to scientists and researchers, rather than, getting all of our information on Facebook or WhatsApp groups. I think always talk to somebody who's done the research and education into this as compared to getting information from any place else.
There's another question.
Very interesting question here about using masks when someone in the family has the flu. Masks are new in our American culture. They were practiced more in East Asia. I would say if you are living in a crowded household and it is difficult to maintain a distance from a person who's suffering from flu, then it would not be a bad idea to cover your face with a mask. And the person who's suffering from flu, if they covered their face with a mask, that's not a bad idea at all.
Absolutely. I would agree that even in the hospital setting, if a person comes in with flu, we do have them in special isolation rooms and precautions as well. And all the healthcare workers are wearing surgical masks when we go in and see these patients. And we usually do from, 7 days from the onset of their symptoms, or at least until like 24 hours from their last fever or other respiratory symptoms. So I would definitely agree that, family members wearing masks at home as well, if somebody has been, afflicted with the flu.
There was another question, does vitamin C prevent flu? Anyone wants to take that one?
I'll say that for any viruses, all different kind of viruses, not just for flu, vitamin C is good, it helps. But remember, it's just like, you have to take the medication. If you got flu, you have to take the medication as well and treat it appropriately. And you can take vitamin C. There are data that vitamin D helps also with viral infection. Just like with measles, it has been proven that vitamin A deficiency, especially in developing countries, it caused the kids who got measles and they had vitamin A deficiency, they had a lot of complications. So when they treated it with vitamin A, they did much better. So there are different vitamins that have been proven. So it's always good to eat healthy, take vitamin C. There are some data now that even for coronavirus, they are saying Covid-19, they're saying that it's good to take some supplements of, if you're sick with it, vitamin C, vitamin D, which are present in the multivitamins.
And as Dr. Ghaffar has just mentioned, I think there was a question that how much rest is needed. I think for anyone who has been afflicted with the flu in the past, how generally weakened a person becomes, they don't have any energy, they have no pep. So obviously, take as much rest as needed, make sure you keep yourself well hydrated. Really, most care for the flu and even for COVID-19, it's mostly supportive, unless a person starts developing, concerning symptoms such as difficulty breathing, or if they're checking their oxygen saturations at home and they start falling, then that's when you need to seek medical attention. But otherwise, it's mostly supportive care, plenty of rest, plenty of hydration, Tylenol, things like that for fevers, and just give yourself time to heal, to recover.
There is another question about when coronavirus vaccine becomes available, should we get it right away? If it gets available, I'll get the vaccine and I will recommend it for my patients. People are worried about, and a lot of my patients or their parents are asking me this question, that this vaccine is coming so quickly that they are afraid. They don't want to be guinea pigs. I have a lot of patients who have asked me in the last few weeks, and I tell them that they need to understand that this is the virus we were not expecting. So that it was in 2019 that we found out about this virus. So no one had enough time to, do the studies like we have done it for flu vaccines, but they have enough data of the efficacy and safety of the vaccine. So I will recommend that once it's available, everyone should try to get it, especially the ones who are high-risk patients. And it will, when they'll start supplying the vaccine, they'll first give it to the high-risk patients, and then they'll go from there based on the availability.
So someone here said, I'm 60 years old and never had a flu vaccine. And my daughter's primary care physician discouraged me to give them flu vaccine because he thought that their immune system will stop working. Is this true?
No, this is not true.
Not at all.
Not
Just
at
the
all.
opposite.
If you are 60, you are a high-risk patient, so you need to take the vaccine. And I have never heard about that the immune system will stop working with the vaccination. So this is not proven at all.
There's an interesting question. Okay, so somebody's testing probably here. What are long-term effects of flu, and do you trust CDC and Dr. Fauci?
I just say they're not long-term effects of flu. So once you get flu, you'll have symptoms for a few days to a week or so, depending on, if you were treated or not. If you get treatment, then the duration of the illness will be less, but there are no long-term effects. You may get a complication, you may get pneumonia, you may get a sinus infection. Your asthma can get exacerbated, so it may take a little longer to get better. Like rather than 1 or 2 weeks, it may take you 3 weeks, 4 weeks, but there are no long-term effects of from flu.
And do you trust CDC and Dr. Fauci? I say yes to that.
Yes.
And we have to trust.
I would say yes to that as
Yes.
well.
Yes.
As physicians, we are scientists first.
Mm-hmm.
And a scientist always questions everything. So yes, we have to trust the bodies that govern our scientific system, CDC, FDA, NIH, and Dr. Fauci is part of the National Institutes of Health. So these are premier bodies, and we must trust them. We should read journals, and we do that. And we make, critical choices based on that. We are scientists, and we follow the science.
Does flu vaccine affect fertility? Going back to my original answer that the flu vaccine, it does not affect fertility. It does not affect, it does not cause autism, cancer, or anything like that. Flu vaccine is here. It's to protect us. It's to protect the vulnerable members of our society. And actually, if you think about it, that's really all of us. As Dr. Kable had mentioned earlier, that everyone should get a flu vaccine. The ounce of prevention is worth a pound of cure is very, very true with the flu vaccine.
Dr. Rapat, I would like to ask you to go back to that question on vitamin C and vitamin D. Can you tell us how much is a good dose? And is there such a thing as too much of vitamin C and vitamin D?
The recommendation is just to take, enough fluids. You can take orange juice, but it's not like you are supposed to take too much of it, So get yourself hydrated, drink 1 or 2 glasses of, orange juice. You can just take some regular multivitamin, but that's about it. There's not like a good data on it that how much of the vitamins you should get. It's in general that when you're sick, you take enough fluids, make sure you're taking enough vitamin C, but that's about it. It's not like a recommended dosage.
Now for COVID-19, the dosing has been 1,000 milligram of vitamin C that have been suggested.
Mm-hmm.
There are no randomized controlled trials to even prove that theory, but zinc and vitamin C does reduce viral replication, is how they think it prevents the viral infections. So typically it's a water soluble vitamin anyway, so you're not going to have an excess of it in your system. Anything extra in your body is going to be flushed out.
But it's not like a recommended dose, like exactly that how much you should be taking.
Right. For most of our patients that are being admitted with COVID-19 or outpatient, it's been 1,000 milligrams is where I've been.
But I don't think so for flu there is any like recommendation, like exact dosage for flu.
There's a question, is all vaccine made in India?
No.
India is a very big exporter of medicines and vaccines. They make good quality products, And if you go to Walmart or any other pharmacy that is selling you medications for $4 or not even $4 on your insurance, read the name of the manufacturer and look it up. You will find that these medicines are coming from India. These are good quality medicines that have made access to medicine very, it has made cheaper medications accessible to Americans. Of course, we like to go with Make in America. And of course, if we can produce good quality medications, which are cheaper in the US, why not? Looks like we've answered a lot of questions for everybody. Do we have anything else? While we're waiting for more questions to come, I just want to repeat what I said in my introduction in the beginning. The AMWPA has plans for flu vaccine drives this year. We have been doing them for many years, and our next ones are coming up in October. The dates will be announced in your masjid newsletter. We will also try to share them on our Facebook and our other social media outlets. So look out for dates and times. Flu vaccines are given free of cost if they are given through AMWPA and our partner THR.
There's a question, will we be able to view this recording again later?
Yes, we have a page on YouTube. Well, it's been answered by Natasha in the chat. But anyway, let me repeat it. We have a page on YouTube. You just need to put in AMWPA and it comes up. There are other lectures also in this. Please view, subscribe, like, share. So I don't see any more questions coming up.
And I have sorry, I have like, somebody's calling me from the newborn nursery, so it seems like an emergency, so I'll just quickly answer that.
Okay, thank you, Dr. Ghaffar.
Okay.
Okay, I think we will wrap up now. Thank you so much, everybody, for joining us. We have our periodic lecture series, and we have another one scheduled tomorrow. If you have a young budding nurse in your family, or you know a friend who wants to be a nurse, they can join in for this, how to plan a career towards nursing. And with this, I would like to thank Dr. Kable, Dr. Ghaffar, Dr. Shazia Khan. Thank you so much. And thank you, Natasha, for putting this together for us.
Dr. Kidwai, there is one more question that is here. Where can they go to get a free flu shot if someone does not have insurance?
As I said, AMWPA will be doing flu vaccine drives. And this announcement will be made by your masjid. So follow their newsletter and see what dates we have. Right now, we don't have any fixed date for our flu drive. Some of the masjids that we know for now, one of them in Collin County is Plano Masjid, and then the IAMT in Richardson, these two masjids for now. AMWPA is working on getting more flu vaccines privately so that we can spread it to other masjids also.
Health departments also give flu vaccines as soon as they become available. So that will be the other source.
Yes.
Another question is how to find out about upcoming Zoom presentations like this one.
We have a Facebook page, mwpa.org. We are on Instagram, and we spread word through WhatsApp messages. And then, of course, the Masajid advertise it in their newsletters. So look out in your Masjid newsletter.
It says, we know that. What about other people who do not come to masjid through?
Okay, so Facebook and Instagram, and we try to share widespread with our WhatsApp groups.
Now, is the
not just within.
Facebook page, do you have to be a member to be part of Facebook page, or it's just open to public?
Natasha, can you answer that? Okay, Facebook page is private.
That's what I thought, yes. So
Yeah.
LinkedIn though, is that private or is it open to public?
Not LinkedIn. We're on Instagram.
Is
Yeah.
So
Instagram
let me help you with that.
Yes.
They can
Thank
go to our website. This is Dr. Haq. I'm the current president of AMWPA. So you can go to our website, www.amwpa.org, and all the information is listed there. I think going to the website is your good resource. If you are not in contact with the newsletters of mosque, it will have all the upcoming lectures. Every month we are doing these virtual lectures, and also for students, like nursing 101, and if you want to become a doctor, how to help with that. And then on our YouTube, we have our channel in the name of AMWPA. So the lectures, in case if you have missed any lectures, all the lectures are there, which are very helpful from the preventive standpoint and also for the students. Thank you.
Thank you, Dr. Seema.
Well, thank you all very much. Good work.
Thank you.
Thank you, everyone.
Thank you, everyone. So everybody's free to leave then?
Yes.
All right. Guys, have a good weekend.
You too. Thank you. You're looking lovely.
Thank you.